SyBusiness.com podcast with Tony Rourke and Kevin O'Flaherty.
SyBusiness.com, making you money.
Share it on Facebook, share it on LinkedIn, Twitter,
our blog, YouTube, video, listen to our podcast. It's so hot that it's burning up the stereo.
Welcome to the SyBusiness.com podcast, coming to you from our speakeasy in lovely downtown Downers Grove. Our guest today is Monica Kendall from Healthcare Solutions Team. Our hosts are Kevin O'Flaherty from O'Flaherty Law and myself, Tony Rourke from ADR Business Resource Group. We invite you to check out our website, SyBusiness.com. If you find the podcast helpful or if you want to help us, we would appreciate it if you review us on iTunes or share our podcast on social media. So without further ado, I'll hand this over to Kevin.
So our topic today that Monica's going to be talking about is treating every customer like your future sales force. Monica, why don't you start by telling us a little bit about your business and what you do?
I am an independent health insurance broker. I basically counsel people on health insurance programs that are good for them, hopefully direct them to something that's going to work best and for their particular situation. And you know, if getting a subsidy is appropriate, helping them through that process. If they're a small business, showing them how to put together a group product, whatever it needs are.
So I've got to ask you, can you tell us some things that business owners and entrepreneurs need to know about health insurance in this kind of changing climate we're in?
It's only gotten more complicated. It's really important to work with someone who specializes in that field. And in the olden days, you'd have people who dabbled. Health insurance dabblers, I would say, but they were more interested in selling an annuity or possibly hooking up with your property and casualty insurance, that sort of thing. And now health insurance has gotten to be its own kind of wild animal that needs somebody who's really in it, understands the law, and understands how to work with all the systems that are in place. So it's important to have a good consultant on your team for that.
Sure. I've talked to people that are in your field that don't even understand. They say, we don't even know what the law is right now because it's being applied so strangely or differently from the way it's initially written. And are we in a place with the Affordable Care Act right now where if I'm an entrepreneur and I'm going off on my own, let's say I've got a chronic illness or, you know, I'm someone who would have been uninsurable, 5 or 6 years ago, are we in a place where most people can get insurance? It's just maybe expensive.
So the huge up about the Affordable Care Act is that there are no more pre-existing conditions. Anyone can, from the day it's effective, it starts 100% coverage from day one. This is huge. This is a big, big, big step forward. And I do hope when this thing gets refined that they don't throw the baby out with the bathwater. Yeah, it does increase the price, and that's unfortunate. And the younger folks are paying a lot for the older folks, basically, is what it amounts to. But, the fact that even if you're young and you had a serious type 1 diabetic who's, 18 years old, and the days gone by, as soon as they came off their dad's plan, they're in trouble. And, we're in a better place now for those folks.
So that condition is gone. So
No, it's not going to affect their insurance. You're
nice.
Just going to walk right into it, have full coverage day one. Yeah.
Well, I remember when I was thinking about starting my business, I've got Crohn's disease, which is a chronic illness, and it doesn't really affect my daily life at all. But when I was thinking about starting my business, the whole Obamacare thing was going on, and I was like, well, if this law passes, I can probably start my own business. But otherwise, I need health care from my employer. So that's, not to get too political on this show, but that's one thing that is a big, powerful thing for business owners that might otherwise not be able to be a business owner because they wouldn't be able to get insured unless they were in a big company.
Absolutely. I mean, it took a minimum of 2 people on a group plan. And I still have situations where that's still a good way for a business owner to put together a plan. But you have to have 2. So you'd have to figure out a way to get your wife in on the plan too or something in order to have insured you as a small business owner before. As a matter of fact, when my husband and I broke off, this was before that we went from a group of 10 at our old business to just the 2 of us. That's what we had to do for his coverage because I could get through underwriting, but he could not. So,
do you see a lot of, I know that at some point you hit a threshold, and maybe you can tell me what that threshold is, where you're required to provide health insurance to your employees. What is that threshold, first of all?
It's 50 full-time equivalents. So basically, right this year they're giving it a little bit of a buffer. Through the rest of 2015, it's 100 full-time equivalents. Next year, it's going to bust down to where they wanted it to be in the first place, which is 50. What that means is if you had, for instance, 30 full-time employees, but you had another 50 that were 15 hours each, every time they get to 30 hours, they count as one more.
Okay.
So you stack them up like Legos, if you will, until you get to that. Now, once they get to that threshold, if that company doesn't offer a health insurance program for the company, then if one of those individuals runs out and gets insurance with a subsidy on the marketplace, they get hit with a per employee penalty at that business. So it becomes it's pretty steep. It's pretty rough. So then, and we're looking at that situation where those folks are now kind of trying to crunch the numbers. Do we pay the penalty or do we actually try to put something together? And I have several people that I've consulted like that are going to do something next year. Yeah, hard as it might be for them, they're going to do something.
One of the things that came up in the media in the past is that you got a lot of business owners that are right on that line. And I'm wondering, well, in the rhetoric is that, well, people are going to get fired. They're going to get let go. Right. So they can get right back. Is that really a concern? Is that something?
Oh, yeah. I've talked to business owners who say, absolutely, I'm not hiring. We're not going to go past that.
Wow. And so that magic number is 50?
Next year it's 50. This year it's 100.
So if you have and I'm just presupposing, but I'm curious, if you have a business owner that has business with 55 employees, 5 of them might be on the hook.
Yeah.
Wow.
I have people that are already said that they're not going to do it. And they can't afford to,
Yeah,
it's a
I
matter
get
of,
it.
They can't even afford to pay the penalty. So they're trying to figure out a way to keep the doors open and keep the other 49 people employed. I mean, I feel for them. It's a tough spot to be in.
That is a nasty.
It is.
Especially in the United States of America, because most businesses are under 50.
And they are. It's 89% are under 50. 89% are under that 50 threshold. That's huge.
I remember before the Affordable Care Act, or at least this was my impression, if you wanted to be competitive and get decent employees, even if you were under 50 employees, you had to offer health insurance because everyone was looking for that because they needed to get through their employer. They couldn't get it on, the individual market. Since the Affordable Care Act, you see less small employers offering health insurance because they figure, well, it's out there for people, and if no one else is offering it, we don't have to offer it to be competitive. Or do you see a lot of small employers still offering it?
So smaller employers, if they're doing it for, to attract and retain good employees, will find a way. And they often, I have small businesses that are like 4 or 5 people and they're offering nice benefits, The other thing is because they're not in a situation where they're going to get a penalty, they do it differently. Well, sometimes they'll do a reimbursement plan. You can do a tax-free reimbursement plan for a small business where they say, instead of them getting involved in all the, HR problems of trying to put together a good plan, they'll say, I'll give you employee A $500 tax-free to get your own health insurance through our Section 105 plan, or our IRS has two codes that will work. You can do a 125 or a 105 if they're both structured correctly.
Now, what's the upside to doing that as opposed to just giving that employee an extra $500 in their paycheck?
The tax-free, basically you're giving them a third more money to work with, essentially, so they can then.
Because they save on taxes by doing it that way.
The company does, and the employee. It's tax-free to the employee, so they can, it'll have more bang for their buck. But I do have people who just bonus them too.
But that would only apply to. That's only up to how many employees that you can get away with.
Well, you can do it for much bigger. There are companies who are much bigger than that who do that.
Oh, really?
And the ones that are over that 100 threshold, 200 threshold, whatever, they've crunched the numbers and they've decided it makes more sense for us to offer it this way and pay the penalty, kind of a pay or play decision. We'll put those things together and we're still in a better place than if we were to offer a group plan.
Interesting.
Yeah.
And when you do that health insurance reimbursement, if employee A needs $1,300 a month and you're offering $500, you don't have to cover the whole 1,300. You can just, cover that 500 across the board for all your employees.
Right.
Oh.
Right. And if you do the one plan that I go through Task, which is one of the third-party administrators that we use, it would allow the employee to pull out their own salary tax-free to pay their side of it if they need to.
Okay.
Yeah. So you get a double side.
Well, me and you need to talk because that's interesting.
That sounds really interesting.
It is nice. Well, here's where that kind of flexibility works well is that you have particular needs in your family, but you might have an employee who has completely different needs. A group plan is a one-size-fits-all kind of approach, or it might be 2 offerings, or maybe sometimes 3. But even so, you're limiting people to the kinds of insurance they're picking up based on carrier, based on out-of-pocket expense, whereas when you do a reimbursement, it's very hands-off. You don't have to worry about what they buy. It's nice.
And something that's always scared me about doing a group plan is, and correct me if I'm wrong, I was always under the impression that if I've got one other employee like me who's got a chronic illness, I don't have any control over how much I'm going to be paying on that group plan, so I've got to offer it to everybody, and am I wrong about that?
That's gone. Those days are gone too. So,
Okay.
So the healthcare reform affected groups and individual, and that now it's all just community-based rating, which is basically sounds like it means where you are, but it's not your age.
Okay.
So the only thing that changes the price of a plan is the age group. So if you're all young healthies like you, I mean you're young, so that's going to change where the cost is, not your health conditions, even in a group plan.
And let me ask you, this is becoming a personal consultation for me.
That's okay.
Hey, whatever it takes.
Maybe some other business owners have similar questions.
That's it.
So I'm doing my own health insurance through the firm, and it's expensive. It's like, for my family, it's like $1,300 a month. Maybe that's not expensive. I'm happy to pay it just to be insured.
Mm-hmm.
If you do a group plan, is there a way to make it from what I'm understanding you saying, the fact that I have Crohn's disease wouldn't necessarily.
That's not going to affect it.
Okay, so on an individual basis, even though I'm paying for all my employees too, on an individual basis, mine might be individually cheaper.
Mm-hmm.
Oh.
Yeah. Because how old are you, Kevin?
33.
Yeah, that's young.
Yeah.
In insurance world, that's young.
Oh,
Yeah.
well, we have a lot to talk about offline, Monica.
Okay.
We've known each other for a long time, and I'm sorry I've never picked your brain about it.
No, that's okay. That's okay. There's a lot of ins and outs to the whole thing, and that's always been what kind of excites me about doing it, is that it's sort of the problem-solving portion of it, where you can gather information about people and their particular needs, and then you can really carve up something that works well. It's fun.
Well, and there's a lot of I thought I was pretty educated on the subject, and it turns out there was a lot of misinformation I had rattling around my brain.
You are not alone. So the biggest thing that I think I said repetitively for the last 2 years is you do not have to go to healthcare.com. And everybody thinks you have to go to healthcare.gov. That's the only way you can get health insurance now. Absolutely not, and it's actually a bad idea. The only reason you would go to healthcare.gov is if you can qualify for a subsidy and you want one.
Okay.
So that's the big step. And if you don't,
That's a nugget.
That's a huge nugget. And I don't know why it seems like it's never gotten out in the media.
It never did.
I know.
They
With all the
They
talk.
pushed healthcare.gov.
Right.
The media pushed it
Totally.
completely.
And one of the things I heard early on that bothered me more than anything was that it's just like Travelocity. Well, that's setting up your flight to Florida. You're probably going to be fine with that. But for your health insurance, no, you need to have some help, and you need to, like, the biggest step is to know, do I fit into that subsidy category? It's a real easy calculation to find out. I use a calculator that Kaiser has online, and there's a couple of websites you can do quick calculations based on your gross income and decide whether it makes sense to go that way. And if it doesn't, don't go in there. Risk security of all your private information, your Social Security and all that stuff, birth dates, everything. And they haven't said that it's terribly secure to this date. And just don't go there. It's not worth it. You can just buy your insurance directly from Blue Cross or Aetna or wherever is the place that's best for you.
Interesting.
Mm-hmm.
No, I have to mention your previous life business that you had.
Mm-hmm.
Can you tell everyone what you did before you were in this line of work?
Sure. Yeah. My husband and I had an animation studio, which is still going strong. He still does help them somewhat. He's down there today working on something with them. but we sold it in 2004 to our two favorite employees, and they're going strong. But my daughter was 2 when we did that. I thought, oh, we could do it all. I'll have the baby at the studio with me. It'll be great. But no, that didn't work out. It was time to sell it, and you really be smart about, raising our own kids and, being there, not just giving them over to a nanny. And I look back.
Where was the studio?
It's on Ohio Street. So it's 657 West Ohio Street in Chicago. They do mostly television commercials, but a lot of other, specials and stuff like that too.
How did you go from animation studio?
I've gotten that question a lot. So, being a small company and being a mom and pop shop, because I tended to be, which is the more analytical side? Is that left brain?
I think so.
I think so. Right brain is creativity.
Okay, my husband's right brain and I'm left brain, and because the two of us starting the company, he would be more the creative side, and I'd be the one trying to make sure that the bids were high enough that we actually profited something, and that we were negotiating good deals with our vendors, and I tended to do all that side of stuff. And that because we had a health insurance broker that went AWOL on us at some point, I don't even know when it happened, I sort of took that on too. And I had my own bugaboos with the health insurance, with getting our employees covered and keeping, because even then there were holdouts with group. We had a group plan and we had holdouts. So we had people who had pre-existing conditions on that group plan back then. That shows you how old I am. But so it's always been something that bothered me. And then when we sold the company, I didn't do anything for a couple of years. And then I had an itch to get back to work, and I wanted to be self-employed. And at one point had a huge amount of problems with some medical billing from when I had my twin boys, who are now 7. And I was grousing to my sister, there ought to be somebody that can help you with this. And she said, Monica, that's called a health insurance broker. I went, oh. So then the light bulb went off and said, that's what I want to do. So I got my license and got educated and got on with it. I've loved every single second. It's been
Great
6 years.
Story. I like that.
Your animation studio did some pretty famous commercials too. I have to mention that before we move on. As a child of the 80s, what were some of the commercials that people would know?
We did a lot. We do. They still do a lot of Lucky Charms and Trix cereal and
No way.
Yeah, Honey Nut Cheerios Bee and Mr. Clean and tons of critters like that. We had a really fun one we did for that was a Super Bowl spot in which they did a bunch of icon characters like that having Thanksgiving dinner. It was like a dinner. So you had Count Chocula and Green Giant and all these guys around a dinner table. It was a MasterCard commercial, so that was a lot of fun.
Yeah, we've got a celebrity in our mix.
That's really cool. Really cool.
So let's talk about your topic a little bit, which was turning your client into your future sales force. Mm-hmm. What are some things you've learned about that, or strategies that you use in that area?
So that is been sort of the biggest epiphany in my business, is that I have found that you just don't have any pretense about just doing your absolute best work for each person. Don't worry about how you're going to be remunerated, because that person will go out and talk about you and send 5 more people your way. Now, if they're a jerk, you probably don't want them talking to anybody. But I find that kind of person often is not a jerk. They might be really needy and they might need a lot of hand-holding, but man, they're the most grateful people, and they send other wonderful people to you. And it's just been, at this point, I've been able to pull back on advertising. I've been able to, it's almost all referral business at this point.
Really?
And I really do say
no cold calling, huh?
Not anymore.
Yeah, you.
I love it. I love it. I mean, the phone rings and it's somebody saying, so-and-so told me to give you a call because I was just telling them that I'm coming off my group plan. I need some coverage, and happens all the time.
Our last guest, Ben Chernivsky, talked about how he used to operate his photography studio in a way that was focused on him and his work, and then he switched to a client focus, and that kind of changed the way he did his business. Mm-hmm. Were you always, when you went into this from the beginning, were you always, that client focused, or did you flip a switch at some point?
Maybe somewhat, but the more I realized that the more you put in to it, the more you get back out of it. It only solidified it for me, and I got more confident and not worrying about the bottom line on every transaction. That just isn't meaningful. If you're dealing with decent people, they always come around. You're casting your bread on the waters. I've had tons of people who I could do nothing for who have referred me like crazy. And I still can't do something for them. They're still right where they should be. So it is the nature of the business.
It's kind of fun. You look so gratified with it.
I enjoy it. I really do.
It shows. Just so now you're communicating it. I love it.
Thank you. Yeah, it's great.
So there's kind of a balance you have to strike though too, right? Because you're selling your time.
Totally.
And do you ever get those clients that? Because I do. I try to provide above and beyond service too. Mm-hmm. But every once in a while, and not every once in a while, a lot of the time, we'll have clients that abuse that and want us to be our, psychologists, and but they can't afford to pay us to be on the phone with them at an hourly rate, and we've had to find a balance between providing excellent customer service and going above and beyond, and not letting a client's bill run up while they're chatting away with us on the phone. It's a little easier when you bill hourly, but for you're getting paid the same either way, so you're the one taking that hit.
Right.
How do you strike that balance between just providing amazing service and being there for a needy client versus, do you ever have to draw a line?
I do. Yeah. There's no doubt there are people who do abuse that, and the good thing about that is that it's not hard to say no. It's very easy to say we're beyond where I can help you. And if they're, there was a time in where I would take abuse from people. No more. No more. I do not.
When you have people beating down your door, you don't have to do that.
No, I just say, and a lot of times less sophisticated individuals will mix up what I do with what's going on in the world. Okay. And as opposed to seeing me as a conduit to a means to an end, they'll mix me up with Blue Cross, or they'll mix me up with, and it's like, oh, no, this is where you need me more than because I understand that their administration is 5 weeks behind, and I'm going to know the back door, and this is where we need to get this fixed. And the good news is, and I've gotten better at this over the years, is I've been better about seeking out the smart ones and trying to find a place for the people who aren't so bright. And I have a really smart book of business at this point, and it doesn't come overnight. It's okay. Just kind of take it as it comes.
Well, and when you're dealing with sophisticated clients or, respectful clients, everything's gravy. You can provide amazing service to them, and you don't have to strike any balance because they're going to be respectful of you. And it's when you're dealing with that small percentage of people that are not respectful of, what you're doing in your time that you run into trouble.
And sometimes it's a very small percentage, and sometimes you just got to let that go.
You do, yeah.
You just got to chalk it up to, that's my one for the week. See, and move on.
And this is, my husband is just awesome, because I had one just a couple of weeks ago where referred to me out of Florida. She called me up and said, this her words. I don't know if I'd ever get to this point, because I wouldn't want to ever, no matter how dire my situation is, I wouldn't want to put this phrase together. She said, I'm dying of cancer, and the next few months I know I'm going to need this, and we're losing our coverage. I was on COBRA from my past employer that I've exhausted that, and now we need to move on. My husband spoke to a guy he knows who's a broker here in Florida, and we found a plan we think we like, but I spoke to so-and-so, and they suggested I give you a call to just double check it. I said, tell me who you're going to see. Tell me about the doctors that you see. Tell me about all this stuff. We kind of, debugged the whole situation. And she very quickly had a list of important things. Now, the plan that the other broker was going to sell her was an HMO, and it was a platinum plan, which means there was very little out of pocket, which is nice, especially for them when they knew it was going to be an expense, but it was an expensive plan too. Did very minimal research to find out that all of her doctors and her main cancer center were not in that
plan. Yeah.
And so didn't call back right away. First, then sought out some answers. So I had about 5 or 6 plans laid out to explain that these will work, And in this scenario, this one's an HSA, and I think this is going to be your best bang for your buck. You're going to have less premium, and you're going to have a better way of paying for your out-of-pockets. So I call her up. She's almost in tears because she feels very frustrated with this whole situation, the whole way all of this transpired. And she said, I really think you need to talk to my husband. He's the one that's been pulling these strings. I said, absolutely, put him on the phone. I'm here, no problem. So I do it a screen share, which is the way I usually do my long distance business, where I can share my computer screen with my client. They can see the plans. I walk them through the details, explain everything, got him all set up. He goes, yeah, this is definitely what we want. Thank you so much. And I said, no, your wife told me you had another broker that you were working with. So, do you want to sign up with it? Well, let me think about it a little bit. Well, then he actually sent an email, cover copied me on the email to the other broker, put the plan that I was suggesting in there, emailed the other broker and said, I've spoken to this woman in Illinois. She's come up with this great plan. This looks like what we want. Can you sign us up for it? And cover copied me on the email. And, I looked at my husband and he goes, you won. Basically, your classy approach won because he weeded himself out of your life. And you said, you're absolutely right.
You got that right. Sometimes, yes.
Yeah.
I learned that a long time in retail.
Yeah.
And I used to work at Marshall Field's in the electronics department.
Oh, okay.
Obviously, Oak Brook, you're going to get some characters,
Yeah.
right? That think just because they're money, blah, blah, blah. Sometimes it's just better, go to the manager. This dude wants this. I think we should give it to him. He spent $2,000 on TV. Give him that. That bookcase for $119. Go ahead.
Just throw it in.
It's more than worth it because they come back stronger. When you give in to them, they come back hard.
Yeah, it's a little give and take all the time.
Absolutely.
Yeah.
We had a guest on, Chuck Zimmerman from Sandler Training Centers, who talked about, sales approaches for salespeople. And he's like, well, the customer has an approach too, and it's mislead, steal information, mislead again, and then hide. And that reminded me of that. And that's something that we have to be careful about too. What people are paying us for as attorneys is, what's in our heads. And if we, it's a balance between educating people and, spending 3 hours with someone and giving stuff away for free, the product that we're selling. And that's a tough balance to strike too. That's unfortunate. That hurt me to hear that story. Because I've been there.
Totally. And maybe last year, the year before, I would have been, throwing every F-bomb I could on that one. But the truth is that my husband keeps me grounded and said, no, do you realize what a great gift that was, that guy revealed himself so well and he's not in your life?
Yeah.
And that's true.
And honestly, how many of those do you run across?
No, that's the
Right?
point. That's actually, we do Sandler at my company too. My point about the Sandler thing is that kind of assumes what has not been what I've experienced, that you may be 50-50, that people are 50% jerks and 50. But my experience has been it's much more good folks.
Yeah.
Maybe much more weighted in that zone. And I don't know if I'm a Pollyanna or not, but I don't run into many people like that guy.
I ran into a sales trainer, when I was selling carpet back in the late 80s. And he's thoroughly convinced. I can't remember this man's name, but he was thoroughly convinced. There's only 10 people that are really, really bad in the sales world. They just circulate. They morph into something else, and they say he and his point was, don't let the bad one, just don't. Yeah. It's just not worth it.
Right.
Shake it off, move on.
Yeah. There's a lot more good out there, and it's not. It doesn't make us quite as big an impact. It's a quieter footprint. Or smaller footprint, that's it, not quieter.
So other than just being generous with your time with people that need your help, are there other ways that you kind of wow your clients and provide amazing customer service that turn them into advocates for you? I
use my cell phone as my main phone, and then I always pick up or take a text 24/7 if they need me. And I tell them that. Once again, it's dealing with good folks, because I say when I'm closing the deal, this is my cell. You're in the ER at 3 a.m. and you need something, use it. That's what I'm here for. But, trust me that you're going to wake up my kids too. So be mindful of that. And so, but people are good about it, And I've had a couple situations where I have gotten that late night call and it's been an emergency, so it's okay.
That's the best thing we could come up with too. We give my cell phone number out on our website, and I try to answer. I don't always answer it. I do my best, and try to be accessible, and that's
Totally.
Be accessible and be genuine and be there to help people. That's as a service provider, that's probably the best thing you can do.
Totally, and I think that goes along with having that smart book of business because they know when they're in trouble, and they really need your help. They're not going to abuse that,
Do you ever ask for referrals, or do you just provide a good service and the referrals come?
I don't ask. And that's another thing that I've been told at my company. I don't swim upstream from what they train us at, but I don't ask, but they come, I don't know. I feel like it's presumptuous of me to say that to somebody. I might be wrong, but I feel like they're going to do it if they feel motivated. It's not a problem,
Sure.
And if I have to ask, then
it might be I've always been afraid to ask for referrals because I don't want to, look like I'm begging for referrals. It's everybody wants referrals, but
sure.
Everyone should know that everyone wants referrals.
Right.
Without having to ask. You don't want to come off as sleazy. You
Right.
don't want to come off as like you're using them for something.
No, not at all. And they're so happy to give it if you do well by them. They become your best sales force, like I was saying. It's a great thing. It takes a little time to build, but once it's there and it's going, it becomes an annuity that continues. So it's great.
So Monica, if unless you've got any other questions, Tony.
No, I'm good. I'm good.
Monica, if someone wants to reach out to you to get some help with their health insurance, how can they reach you?
That cell phone, 312-671-3938. I'm not in Chicago. It's just my old cell phone number from when I was. I'm actually mostly out of my home office in Hinsdale, but our company's office is by the Yorktown Mall in Lombard.
Do you have any geographical limitations on people you'll help? It sounds like you don't because you were working with Florida.
I'm licensed in 12 states,
Okay.
all the ones that are sort of tangential to Illinois, and then a few others where people have referred me, basically.
Okay.
I do quite a bit of business out of Florida because there's a lot of snowbirds. And then Texas is another big one that's not as obvious. But yeah,
So basically, if you're in the Midwest, I can probably
help them out. And I do also, like, I've had people who've come to me and referred somebody that's in New Jersey, and I have some connections that I can hand them off to.
Okay, great.
Oh, nice.
Thanks so much for your time today. It's been a pleasure having you.
Website, monica4insurance.com.
With the number 4?
Either way, you can either spell it F-O-R, or you can put the number 4, Monica with a C, M-O-N-I-C-A, forinsurance.com.
Okay, great.
Thank you.
Thanks, Monica.
No, thank you.